Hi, I'm here today to talk to you about practitioner use of the nonverbal tool of touch to enhance communication. Maria Konnikova, the psychology and science writer for the NewYorker.com, has written, "Touch is the first sense that we develop as human infants. Perhaps remains the most psychologically vital throughout our lives. There are millions of tiny neuroreceptors on our skin. Each type of touch sends a different message to our brains telling us how to feel, pleasure or pain, ease or ache, anger or peace." The Merriam-Webster Dictionary defines touch as a transitive verb. It means to bring a bodily part into contact with, especially so as to perceive through tactile sense, to handle or feel gently, usually with the intent to understand or appreciate, to leave a mark or impression on. When we think of the extraordinary power that human touch holds for us as humans, we have to wonder, could appropriate application of such a powerful nonverbal tool enhance communication? And as such, in the case of a provider to a patient, could we use this to improve patient compliance and ultimately their health outcomes? To help you understand more about this concept, I will discuss an article that I reviewed and tell you about the 3 French researchers who developed this study, the field experimental design that they used, and what they learned regarding medication compliance and perception of the practitioner when touch was employed during consults with their patients. The article's title was "Improving Medication Adherence by Using Practitioner Nonverbal Technique, a Field Experiment on the Effect of Touch." It was co-authored by 3 researchers. ResearchGate.com explains that 3 researchers were employed at the University of South Brittany in Lorient, France. Their names are Nicholas Guggen, Sebastian Manieri, and Virginia Childs-Sire. Nicholas Guggen, the lead author, is a PhD professor in social and cognitive psychology. He has contributed to 325 different research projects. His research focuses on aspects of human behavior involving the influence of nonverbal communications. He is a reputable researcher whose works have been cited over 2,000 times. Sebastian Manieri and Virginie Childs-Sire are also both social psychology professors. Sebastian Manieri has been involved in 54 research projects, 46 of which were with Nicholas Guggen, and the third author, Virginie Childs-Sire, has contributed to 11 different research articles, 10 of which were with Nicholas Guggen. That shows the rapport between these researchers. The study was built on previously well-established literature in social psychology, demonstrating the positive effect that touch affords to compliance with verbal requests and the known positive impression that has been described by the touchees about the touchers in previous studies. Example, tactile contact by a waiter or a waitress has been shown to increase the tip. Touching potential customers for salespeople has increased their sales rates. And counselors, when touching a patient on an initial interview, has led to a higher agreement for a second interview. Guggen and colleagues decided to conduct an experiment to establish if this practice could be employed by medical practitioners in order to improve patient compliance with medical regimens. They related this study's importance to the negative effects that patient non-adherence has, pointing out the waste of practitioners' time, adverse health effects for patients, increased incidence of relapse, and the consequential increased cost of healthcare. The study's focus was on patients that were diagnosed with mild bacterial pharyngitis. There were 6 general practitioners, 4 men and 2 women, with a mean age of 43.8. They were instructed to touch the patient on the forearm for 1 to 2 seconds, which was the experimental condition, or not, which was the control condition, at the end of a patient visit, while stating, "It is very important for you to take your medication as ordered and in order to prevent a reoccurrence." The 2 experimental conditions were applied at random distribution and charted by the provider after the patient had left the office. The study occurred between October 2007 and mid-March 2008. There was a population of 326 patients. 147 were men and 179 were women. Their ages were between 20 and 30 with a mean age of 23.8 years. The diagnosis was mild bacterial pharyngitis. The patients were prescribed penicillin, 1 tab with breakfast and 1 tab with dinner, for 7 days. On day 8, interviewers, 14 men and 8 women, unknowing of the experimental condition, sought out the patients in their home. They explained, "You consulted Dr. X a week ago for pharyngitis and you were prescribed an antibiotic. Is it possible to look at the box and count to see how many pills are left?" Ultimately, 77 of the patients were excluded because 67 of the patients were not home, 4 refused to participate, and 6 could not find their box. The pills were counted, and then the patients were asked to rate the providers on their competence, on a scale of 0 being not competent or 9 being very competent, and to rate the providers on the level of their concern for their patient, on 0 being concerned, not concerned, and 9 being very concerned. Patients were then thanked and debriefed of the experiment, explaining that they had been participants in an experiment on medication adherence. Agreement was solicited for anonymous use of their data in the study, and consent was obtained. The conclusion of the study was that when doctors employed slight tactile contact while verbally requesting compliance with prescribed medication, the result correlates positively with greater adherence to the plan, and when the same verbal request is made rather than when the same verbal request is made without tactile contact. The study also established experimental condition of applied touch results in an improved perception of the provider's competence and level of concern for their patients. The practical implications include the association with patient non-adherence to prescribed medication as a widespread problem for practitioners and insurance organizations alike, as well as a public health issue. Limitations include the lack of generalizability due to the focus on adult patients with a mild illness and a short-term medication regimen. Studies on nonverbal technique of touch in the medical arena appear to be limited. However, I was able to locate another recent study in the literature from 2013. This study by Enid Montague et al. Is called Nonverbal Interpersonal Interactions in Clinical Encounters and Patient Perceptions of Empathy. This study describes that social touch by a provider resulted in better patient assessment of the clinician, but only when it was applied in moderation. It was reported that too many social touches during a visit can result in decreased rating of the likability and connectedness toward the provider. In conclusion, the article that I presented today by Guggen and colleagues discussed a thought-provoking experiment offering reliable evidence to indicate that when providers practice utilizing tactile contact during patient consultations, they may increase the patient's adherence with their care plan. Although a more recent study that I reviewed did raise questions related to what amount of non-clinical touch is appropriate. When we think of the extraordinary power human touch holds for us as humans, we have to wonder, could appropriate application of such a powerful nonverbal tool enhance a communication? If human touch is the first sense that we develop as an infant, and the power of touch continues to be studied in the social science arena, perhaps much more research should be done in the area of medicine. It is such a simple skill for providers to practice and refine to help patients achieve better health outcomes. Thank you.